Hello, my name is Dr. Alex Rutgers. I am the Director of Cleft and Craniofacial Surgery at JohnsHopkinsAllChildren'sHospital. Today, I want to speak to you about rhinoplasty or corrective nasal surgery for patients with cleft lip and palate. Patients born with a cleft lip and palate undergo longitudinal multidisciplinary care for their cleft to make sure that we give them the best outcome possible with regards to their facial appearance, smile, dental health, and speech. Often, that is a long journey, including multiple reconstructive operations. As we reach the end of adolescence, the reconstructive rhinoplasty is often the last stage in that journey. Patients born with a cleft lip typically have significant differences related to the shape and function of their nose. I always tell families that we start and finish cleft care with attention to the nose. At the time of the first cleft lip repair, nasal correction is a critical part of that procedure. My goal at the time of cleft lip repair is to make sure that the nose looks as good as possible during early childhood. We recognize that minor asymmetries may persist, and when patients go through adolescence, their baby nose becomes an adult nose. This means that asymmetries that could not be addressed at the time of their first operation become magnified. Additionally, patients born with a cleft lip often have a deviated nasal septum. This can lead to nasal obstruction and difficulty breathing. For this reason, reconstructive nasal surgery is a critical step in completing the phases of cleft care. The goals of the operation are to straighten the nasal septum, open the airway to improve breathing, and to address any concerns that patients have about the shape and appearance of their nose. We recognize that persistent asymmetry and differences of the nose related to a congenital birth difference can be a source of stress and dissatisfaction with their appearance. We want to craft a reconstructive operation that maximizes facial form and function to boost confidence and the prospect of lifelong success. Corrective nasal surgery is typically performed in a hospital setting just like all other cleft operations. Depending on the extent of the operation, patients may be able to go home the same day following surgery, or they may stay overnight for observation to make sure that their pain is well controlled and that they are comfortable. Cleft reconstructive rhinoplasty is typically performed using open rhinoplasty techniques. This includes an incision across the base of the nose through what is called the columella. Additional incisions inside the nose allow us to directly access the abnormal anatomy and correct it. After surgery, patients will have a cast on their nose to protect the repair and will have packing or splints inside the nose to help us keep the septum straight. I tell patients that right after surgery, they will notice that their ability to breathe through the nose is worse because of swelling in the nasal packing. The nasal splints and nasal cast, as well as the columellar stitches, will be removed 1 week after the operation. At this time, patients will discover the improvement in their ability to breathe. Patients typically have facial swelling and possibly bruising that will last 1 to 2 weeks after the operation. Patients' families and friends will notice the improvement from your operation almost immediately. Most swelling will resolve after 6 weeks. We do expect that there will be subtle swelling that will remain in the tip of the nose for 6 to 12 months following the procedure. This means that the positive effects of surgery are seen early, but that the ultimate outcome will not be evident until you are about a year out from your operation. Patients should expect to take at least 1 to 2 weeks off of school or light-duty jobs. Sports, strenuous activity, and heavy labor jobs will require about 6 weeks of recovery before you can return to them. We typically like to see our patients 1 week, 6 weeks, 6 months, and 1 year following the operation to make sure that they are happy with the result and that everything is healing as planned. For patients who have been on a long journey for cleft reconstruction, this may seem like a daunting task, but it's important to recognize that this is a critical step to finally completing the cleft journey and achieving the outcome that you have worked so long to achieve. We look forward to caring for you, your family, and your child within our cleft and craniofacial team and plastic surgery clinics. Thank you very much.